You spend a lot of time taking care of patients. They come to the hospital or the clinic or the doctor's office when they're already sick, maybe even seriously ill. And while you do a terrific job of treating their ailments and diseases, you don't usually have time to focus on the patient's total health, including wellness and prevention, their social needs, and other risk factors. But there's a different way to think about this. A new vision for healthcare. That's healthcare, not sick care. It starts with us transforming care by creating new care models and building new kinds of partnerships. Primary care physicians, specialists, home healthcare providers, rehab and skilled nursing facilities, pharmacists, and many others. An especially important part of the healthcare team will be the care coordinators, who will ensure we work closely with each other and our patients to help them stay healthy, treat them when they first feel ill, educate them about diseases and medications, and successfully manage their chronic conditions. It's teamwork, with our focus on providing exceptional patient experience and outcomes, instead of us in a line handing the patient off from one caregiver to the next. And we have team goals: to keep the people we're responsible for healthy, and to identify and address small health issues early, before they become big health issues. Now, you're probably thinking, if the patients stay healthy and we decrease the need for hospital-based care, will we get paid for our good work? The answer is yes. Today, after we care for an individual patient, his or her insurance company pays for the specific services provided. That's one way of doing things. It's called fee-for-service. But there's another way too. It's called population health. And here's how it works. We form a healthcare group. We call it our Cleveland Clinic Integrated Care Model, and it includes all those partners we talked about earlier. Before the members of our group provide any sort of services or care for any patients, the insurance company gives our group a pre-established budget to use for all of the prevention and care that we will provide to a certain set of people who have insurance through that company. We are now an accountable care organization. If the members of our accountable care organization don't use the entire budget, we can reinvest what's left in our hospitals, practices, facilities, staff, etc. But that doesn't mean these patients won't get the very best care. In order to be part of an accountable care organization, we need to achieve and report on specific quality and patient experience measures that demonstrate that we're keeping our patients healthy and taking care of them if they get sick. That's our challenge, providing the highest quality patient-centered care while staying within the budget. And we're confident we can do it by using data to help us make the smartest decisions possible and ensuring that every member of our team uses his or her talents, skills, and credentials to provide the best appropriate care at the right time and place when it's most beneficial to the patient. We're enhancing and developing more effective ways to communicate with each other so that we share information, like results from tests and treatments, and don't repeat each other's efforts. We're going to share best practices, coordinate care, make care more efficient and affordable, and so much more. That's population health, creating value by keeping people healthier and lowering healthcare costs at the same time. This will be a massive shift, but we're not doing it all at once. Some patients, or their insurance carriers, will continue to pay a fee for the services we provide, and other patient care will be funded by a risk agreement. You can think about it like this. We're going to have one foot on the fee-for-service dock and the other foot in the risk boat. And we're going to stay balanced. This proactive approach is the right thing to do as we move toward a less expensive and more effective healthcare system.